as we have hosted similar events like this and similar engagements with municipal staff. And during the engagements with municipal staff over the last 3 weeks, we found that valuable questions has been asked, and many of the people were actually satisfied after hearing what the medical experts could tell us in terms of the vaccination. From my side, I'd like, before we start, just express a special word of welcome to Dr. Nelis van Zyl-Smit from the ICU unit at the George Hospital, as well as Dr. Zilla North. For Zilla, it's I think your fourth engagement like this with us, and for Nelis, it's his first, but I can just assure you that the questions and answers that was received over the last three sessions was very valuable to us. In the evaluation of the third wave this morning, I can just give you a little bit of background. We picked up that 3.3%, there was a 3.3 times higher risk of death in unvaccinated people compared to vaccinated workers. And that is specifically looking at the statistics for the third wave and under the healthcare workers. At this point in time, the total amount of people vaccinated in the Western Cape stands at 33.3%. And then also the statistics show us that 96% of admissions to hospitals in the 60 plus group were not vaccinated in the third wave of infections. So it's quite interesting to see this data that was provided to us this morning at the cabinet meeting. At this point in time, we are on a total of 3,329 active cases in the Garden Route district. And we are aware that we are going down in the third wave of COVID infections. I wouldn't say we're at the bottom yet, but there is a downward trend. But we also know that with all viruses, they mutate the whole time, and a fourth wave of infections it will happen. It's a matter of how we deal with the vaccinations going forward, of what the effect of this fourth wave will be. When we ask you to please keep your microphones on mute, I would appreciate that, except if you speak. And then we've got the chat box facility, so you're welcome to put your questions in the chat box. What Dr. North and Nelis would do is they would be answering the questions from the chat box. So without further ado, I think you don't want to hear from me, you want to hear from them. They're the medical experts, they know what's going on, and they can help. Colleagues, I'm then going to hand over to maybe just to start off with for Zilla or Dr. van Zyl-Smit to just first give us a little of a background, and then we will address the questions that you've got. Thank you.
Thank you very much, Gerard. The way Nelis and I have structured this is that Nelis is going to start by giving us a summary of the current situation in George Hospital and a bit of an overview of what has happened with the third wave. And then after that, I will give a short summary of the vaccination process, where we are at, and a few common questions that people often ask. And then we would like to leave at least the last half an hour open for Q&A for questions from the floor. So I think that is the easiest. Let's go for it. Thank you very much.
Yeah, so good afternoon and welcome to everyone listening to this webinar. And yeah, thank you, Gerard, for inviting me to just maybe talk. And I'll maybe just start off by maybe just giving a short presentation, maybe giving you a little bit of background, what we do here at George, and what has been happening with us. And maybe it'll give you better insight into what has been happening in the hospital. So I'm just going to start my presentation. So my COVID hospital. So yeah, just to give you maybe a background. Sorry. So I'm an emergency medicine specialist, and I trained in the UK and then came to South Africa, and I've been at George for the past 4 years. And, you know, we've been, together with other specialists from George Hospital. We were involved in setting up the COVID ICU specifically for the Southern Cape, and also been managing all the critically ill patients in the Southern Cape. So I just want to give a few disclaimers, because I think it's important that that you maybe just have a background about where I am and maybe some of my views. And firstly, I'm not an epidemiologist. I'm an emergency medicine physician, and then also critical care doctor that look after all the critically ill patients. I'm not a virologist, so I do not have all the answers about specifics about the virus, although this is what we deal with every day, but I'm not the specialist in the field. I'm also not an immunologist, so I'm not the best person to ask about spike proteins, although we do have a lot of knowledge about that. I'm not a expert in that field. So just quickly, something about vaccines, because I think it's very interesting. People fall into two categories, and I think the one is, are you for vaccines or are you not? Or you're a vaxxer or anti-vaxxer? And I just want to say, from my point of view, I'm pro-life. I'm not specifically for vaccines. I'm not specifically against vaccines, but I'm for saving lives. And that is what we've been dealing with through the whole of this pandemic. And whatever we have available to us, that is what we use to save as many lives. And as I was doing a run in Witfontein with my wife, I realized that we've been called for a time like this, and our mandate is to save literally as many lives as possible. So I do have biases, and I think it's important for you to understand that I am a medical doctor. So a lot of my views are in the backdrop of having studied medicine, and I do try as much as possible to practice evidence-based medicine. So when someone does send a video appealing to my emotions or my conscience, I have to evaluate that critically. And also when we treat our patients, and that was critical in the time when we were setting up the intensive care unit, what medication do we allow, and what do we think is reasonable to keep our patients safe? So we really based that on the available evidence, and we tried as far as possible, and we do not experiment with people's lives, if that makes sense. So my father-in-law asked me about a video, is that the truth? And I said to him, I don't have the truth. No one's got the truth. And if anyone on some video or anywhere tells you they know the truth about something, they are not telling you the truth. And there are lots of opinions floating around on social media, and there are experts having a lot of opinions. So I will try as much as possible steer clear of opinions, although I do have some of my own opinions, but it's on the backdrop of what I've said on my biases and what I do from a day-to-day basis. So I'll try and stick to the facts, and hopefully that will give you a better idea about why we do certain things. So we've had 3 waves now, and they all kind of look similar to this wave. If you are in the Southern Cape on your December holiday and you feel like you want to body surf that wave, and you see this one coming on, you're never quite prepared, and this is what we've been having to deal with, the wave tossing and turning us upside down. We haven't done this before. So it's been a real challenge, and I maybe want to just give you a little bit of an overview so you understand what we've been dealing with over the past 18 months. It feels like a lifetime. So our COVID ICU, there's an 18-bed unit, and just to give you a little bit of perspective, in the whole of the Southern Cape, George Hospital has 6 ICU beds, and this is for all the patients in the Southern Cape, and I'll give you a little bit of a view about what the Southern Cape means. This was before COVID, and when COVID hit, we had to set up a unit, and we've managed to get an 18-bed unit, which is extraordinary. We've expanded our capacity, from 6 to 18, and those 6 are still earmarked for non-COVID patients. And we've also expanded into the wards to be able to provide critical care for the sickest of the COVID patients, for a total of 24 beds. We try as far as possible, maybe some of you have heard, what we try and do to save people's lives is to use high-flow nasal therapy. So we at all costs try and keep patients off the ventilator. We know that the chances of survival on the ventilator is particularly poor. and therefore we try our best to keep patients off the ventilator. So just to give you an idea about our drainage area, so we are here in George, and if you look at how far we have to accept patients. So this is Mossel Bay, this is all our area, Albertina, Stilbay, Riversdale, Heidelberg, it goes all the way up, Laingsburg, some patients come from Laingsburg, but Merville, Beaufort West, all the way over to Murraysburg, coming down, and then Plettenberg Bay, Knysna. So that is a huge area, and all the patients that require critical care were either managed directly by us. In the third wave, we've managed to have some patients treated at the local hospitals like Knysna and Oudtshoorn that has capacity for high flow. But pretty much all the sick patients have been managed by either me, or we were 2 anaesthetists at one stage that helped, and then 2 other physicians. And it's been a mammoth task to be able to care for all the critically ill patients. So just a little bit of statistics. And as I said, statistics are quite interesting. This is not opinion. When someone dies and I fill in the death certificate, it's not an opinion. It is a fact. So hopefully that will give you an idea about what we've dealt with. So we've seen a total of 631 patients through waves 1, 2, and 3. And we've had about 235 deaths in ICU. And just remember, this is not the total deaths. I mean, there are many other deaths in some of the other hospitals. Harrison May has also taken a lot of patients. But these are patients that have got a good prognosis and that we felt had a very good chance to overcome the disease. So our total mortality is 37%. So that means that if you end up in ICU with us, your chances of dying is 37%, and that's the total mortality. If you happen to be on the ventilator, and that's why we try to prevent it at all costs, your chance of survival is very slim, and your chance of dying then is 73%. And that is pretty similar to what Grooteskier and all the other hospitals, what their statistics are like. I just want to touch on the Sisonke trial because I think it's quite close to home, because we read so much and we hear so many things from especially America and the UK. But this trial was run by by the Department of Health, and us as healthcare workers, we were part of this trial, and we were the ones that were able to go and say, look, we will take this vaccine and to really test. So you can, in a way, say we were the experiment for, and this is specifically just for the J&J vaccine. Unfortunately, this was the only vaccine at that point that was available to healthcare workers. And just to give you an idea, I mean, there were 477,000 healthcare workers vaccinated. So, that is an enormous amount of people. And I think it's of value to just quickly note some interesting facts. So your chances of death when you had the J&J vaccine was significantly reduced. So you had a 91 to 96 protection against death, which is absolutely phenomenal. And you can see the vaccinated people are right here at the bottom, and these are deaths due to COVID. And then the unvaccinated deaths in the healthcare community, this is where the trajectory was. So the bottom line of this is the J&J vaccine, there's a 65 to 66% protection against hospitalization. Of course, nothing's 100%. There's also the protection against getting symptomatic is also sitting around about 50 to 60%. But the main aim of the vaccine, or what we found, is that your protection against death is 91 to 95%. So the bottom line is that if you had the vaccine, the chances of you dying or ending up in ICU was very, very, very small. And just there's obviously concerns about safety, and I know the social media is rife with people that have opinions and not facts. And I think it's important when we hear opinions that we evaluate them critically. We were rigorously, any side effects were reported within this trial. So, we know exactly how safe the vaccine was, and there was no real problem with the safety with the vaccine. As I said, there were, as you can see on the screen, there were 2 cases of a rare clotting disorder, and they made a complete recovery. So no one of those 477,000 healthcare workers died as a result of the vaccine. Now, just remember that in healthcare populations, there are people that die every day. So there will be people that die when they've had the vaccine of other causes. Now, when that happened, that was investigated to see if that cause was actually vaccine or not. So within those patients, there wasn't really, of the healthcare workers, there was no real signal that this vaccine is unsafe. So just bring it closer to home. So this was our 3rd wave. So the 3rd wave was probably bigger than the other 2, and I think it was tough, but we managed to come through it, and we're not finished with it. The tail end of the 3rd wave is a little bit like this guy, you know, hopefully not falling over and tripping over, but we are doing fine at the moment. So I think there are some questions that I think some of you might have, and I think I've put a few questions together that I think might be relevant just to give an idea about what has happened in the garden route. And this is, as I say, these are our people. So how many vaccinated admissions did we have at George Hospital? Remember I told you that we had 631 admissions in the ICU, and there were literally 2 patients that were fully vaccinated that were admitted with COVID pneumonia. How many deaths did we have in the 3rd wave? Because remember, the 3rd wave, the vaccine only became available to the public around about April, May. Zilla has all the details more about that. So, and I think this is an important question because we were the ones looking after all the patients that had a good chance of survival in the ICU. And there were a total of 0 deaths so far. So every single patient that has died, every patient that has ended up on the ventilator were unvaccinated patients. We've had a few patients that maybe had the first dose of the Pfizer and then got sick, but of course that means that they probably had the infection before they started, or they got sick after they've maybe had 1 dose, and of course they weren't protected at that stage. But this is not an opinion, that is a fact, that no one has died that has had the vaccine. How many deaths have we had from vaccinations? Because I think in social media there is a lot of questions how dangerous it is, and some people even saying that the vaccine is more dangerous than COVID. And so we have had in our EC, and I've phoned around in all the neighboring hospitals, Nasa, Oudtshoorn, and so forth. We've had no deaths from a vaccination that we know of at this stage. So how many presented with complications to EC because of the vaccine? So in George, Zilla has the correct numbers. I think on the 3rd of September, there were a total of 52,000 vaccines that were administered in George. So how many did we see and were admitted in the EC that got really sick from the vaccine? And I think as far as we can see, there were about 5, and they were all maybe a bit of viral illness. There was 1 person that developed an abscess in the arm that was easily treated. But there were 5 patients so far we can figure out in George, and also the other hospitals haven't had many more patients that presented because of the vaccine. How many patients admitted because of complications of the vaccine? And that was 0. We have not admitted a single patient that had a complication of the vaccine. So the complications of having the vaccine is extremely, extremely rare. It does happen, but it is extremely rare. I'm just going to show you a video of the ICU. There are 3 videos, so just have a listen.
Most of our parents are over 60, so they are at risk, and therefore we also need to be away from our families and sacrifice our time. And also takes a its toll on our mental health as well, because they are our support structure. So where do we turn to in times like these? Because we have to have the overburden of patients being here, being this ill, you know. And if we just stick to the basic rules,
So the next video is an ICU, maybe just gives you a bit of a picture of what we're dealing with on a day-to-day basis.
Yeah, I think that the most difficult part is just thinking, you know, are you doing the right thing for every patient? I think that's the most difficult part. You know, you go home and you really think, should I have done this? Should I have done that? And the reality is we are having to make difficult decisions on people, and we are losing people where we could have, you know, had it differently if we had more capacity and so forth. But this is what we're dealing with. We are an absolutely major incident, and you know, people are dying. It's really, we're in the middle of the storm, and yeah, I think luckily the team together helps, you know, to lift the spirits, but it's not easy putting someone on the ventilator, putting them in a body bag 5 days later or 14 days later. We've had a patient that was here for 55 days, doing well, we've lost her, and that's really disheartening. And we wish we could help more people, but our mandate here is to really save as many lives as possible. That's what we're here to do. And we do our best, but despite that, people are dying, and it's quite sad. And I think it's sad for the families, because I think the families don't have access to them. The families are not here to hold it.
At the time, I thought it was the right thing to take the vaccine. That's the same. You've got to justify what you do, otherwise you can't. But in hindsight, I know better. Look, I've got the most incredible respect for these people, all of the healthcare staff here at George Hospital, all the doctors, all the nurses, even the people that clean the floors. They, with this, they put their lives at stake. You know? It's an act of love to work there, because they're actually willing to die before think of what you know, to get these people out. And they do it every day. And I've spoken to the nurse, some of the nurses, as I said, they're scared to go at night, but they keep to themselves. It's like they regarded as their duty. But I mean, it's more than just their job. It's more than just their duty. It's something from themselves that they can take care of these people that are so sick. So awesome job. I can't thank them enough. It's hard to do it. I can't thank them. Whatever I do won't be enough.
So just as a close, I think the reality of what we were dealing with is as I said, is disheartening. We've someone asked what was the youngest person we've lost, and I've gone through the list, and I think the youngest person was 23 years old. We lost her about 3 weeks ago. And yeah, she had no comorbidities. We've lost, I think, about 8 pregnant patients, and some of them their babies also. And I think people maybe have a misconception that it's only people with diabetes and hypertension that are overweight that get COVID, but that's not been the reality. Probably around about 1/3 of patients have had no comorbidities, and we've had literally patients that are 30 years old, 35 years, 40 years old, 42, 47. I've got all their faces, not all of their faces, but a lot of them that I treated in my memory. And I think, as I said in previously also, our mandate here is to save as many lives as possible, and therefore my stance is on just pro-life. So thank you for the time. Thank you, Gerrit, for giving me opportunity maybe to give you a glance into the waves. Yeah, so if there are any questions, we can put them in the chat box, and then I'll give Zyl a chance. Thank you.
Great, thank you very much, Nallis. Yeah, thank you for exposing the vulnerability of the healthcare staff so candidly, because I think it's often one of the things that healthcare workers really don't want to talk about, is how their work affects them personally. And I really think that you've done a good job in bringing people closer to your workspace and your space that is really, like that patient said, an act of love. I'm left the hospital in March and moved over to the George sub-district, where we are now managing the vaccine rollout. And I think that I am impressed on the other side of the fence as well, with how the staff just keep soldiering on and keep trying to do their best and making sure that people just stay safe and stay healthy. We were at an ethics meeting at George Hospital yesterday, where we had two very good examples of what's going on at the moment. And the one was the healthcare service currently is being load shed in the same way that Eskom is load shed when there isn't capacity to provide electricity to everybody. That 18-bed ICU that Nellis is talking about is actually the day theatre. And that means that all of the patients that would have had day surgery are not getting their day surgery, because the day theatre has been load shed for the sake of COVID. And the wards that have been enabled as COVID wards are actually wards for patients who should be receiving maxillofacial surgery or cancer surgery or other very important treatments that they are not getting currently, because those services have been load shed for the sake of managing patients with COVID. And the reality of that is that, yes, there is 600 patients that were admitted into ICU, and half of them have passed, a third of them have passed away. But there's other patients. There are our family members that have passed away with other things, with their chronic diseases or with their acute diseases that were not managed because the hospital is currently in crisis. And the amazing thing is that we have an opportunity to really turn this around. As you see, no patients with vaccines have passed away, which means that if we all have vaccines, Nellis can get back to his job in EC again and start doing what they really want to do, which is to help save lives for people who have illnesses that are not preventable in other ways. So at the moment, our vaccine system that we have going in George is able to deliver 1,000 vaccines a day. If we continue at this rate, it means, and everybody who can get a vaccine comes for their vaccine, it means that we are able to vaccinate everybody in George who is over 18 by the end of November. If we were able to do that, if everybody in George over 18 came for their vaccine, then that would mean that there would be no fourth wave come November, December for George. We've heard Prof. Karim speaking on the SABC News and on ENCA and telling us that the fourth wave, given the pattern, first, second, third, each one has been higher than the one before. And if we are able to squash our fourth wave with vaccines and not have our hospital load shedding services like it is currently doing, then that is potentially something that we as a community really need to work towards as a collective, because then we can get back to normal and we can aim for that normal Christmas where families can gather and have a happy time together. So in George, we have 5 vaccination sites. We have Harry-Kumay, Thembaletu, Pakhaltsdorp, Centrum Clinic, and Uniondale Hospital, which is delivering outreach to Uniondale Clinic, Haarlem, Avontuur, and all of the farms in those areas. Well, our 4 sites in George are also delivering outreaches. The Pakhaltsdorp group also go to the Pakhaltsdorp AGS. We also send a team to Blanco AGS. We are sending outreach teams to farm sites everywhere where there's 100 people or more who want to be vaccinated. We are willing to send an outreach group to. At the moment, we are also sending outreaches to schools, to factories. We had a great outreach to PG Bison last week, Friday, where we did 179 vaccines all on the one day. We really, our vaccination capacity is not being overwhelmed yet. And I am really hoping that the youth and that the 30 to 50-year-old population will start to come to the vaccine sites in their crowds and in their numbers, because we are able to give you your vaccine as a walk-in, as somebody who is booked, as somebody who is registered or not. We really don't mind. You just need to rock up at a vaccine site and we're going to sort you out. At the moment, the vaccines we are delivering is Pfizer and Johnson & Johnson. The Johnson & Johnson, we have less stock of currently. So at the moment, our vaccine sites are giving Pfizer, all of them, except for the farm outreach, which is rural. So we don't want to spend all of those, we don't want to expect all of those people who are really far away to also come for a second shot. So they are getting the Johnson & Johnson. Everybody else at the moment gets Pfizer. And when you go to a clinic, you can't really choose between the two. But as Nellis showed you, the difference between Pfizer and Johnson & Johnson, there's only really one big difference, and that is that Johnson & Johnson is one shot. So I think a lot of people are preferring J&J because they don't want the second shot. But in terms of effectiveness, the Pfizer is a little bit more effective in protecting you from hospitalization, and a tiny bit also in terms of protecting you from death. They work in a little bit of a different way. Pfizer is an mRNA vaccine, and Johnson & Johnson is a vector vaccine. Some people have their reservations about this. We get a lot of stories about Pfizer specifically that is currently being circulated in our country. And I think it's because Pfizer is the main vaccine that it's also getting the main target. People are worried that the mRNA protein that the Pfizer vaccine is made up of can actually affect your DNA. It cannot. The way in which it works is that mRNA is like a little pattern that when it gets injected into your body, that little pattern gives your cells the pattern according to which they then mimic a spike protein. So they build a little key that looks like a spike protein, and then your own body's immunity identifies that little key, and it builds an antibody that fits onto that little key in order to neutralize it. So then when your body comes into touch with the real virus, it already had this little mimic of the spike protein that made it able to get used to it, so that when you do then get into contact with the virus, antibodies are ready, they're able to neutralize it, and the virus doesn't have such a good hold on your body as it would have had. We get questions about, can you shed spike proteins? Absolutely not, because you are not creating spike proteins, and the spike proteins are also not viruses. It is only a part or a small particle of something. So that whole question about shedding spike proteins and all of that is really hearsay, and it's not based on any fact or as far as we can see. The Johnson & Johnson vaccine is a vector vaccine. What that is they use a little shell of an adenovirus, and that on top of that little shell, a spike protein from the coronavirus is implanted, and that gets injected into your body. The shell is not a virus, it's not alive, it can't give you any sickness, and the spike protein is not alive either, it's only a part. So it's, as an example, it's like a hair of a human. The hair of a human is not a human. So when that is injected into your body, once again, that spike protein gets recognized by your own cells, and little antibody is created that would fit onto that and would neutralize a real virus. Then when you come into touch with the virus, you are already ready, and you have that key that can then neutralize the virus, which means that you do not get so sick. Both of these vaccines are about 60% effective at stopping you from getting severe illness. As an example, or just to compare, the flu vaccine is about 30, 40, 50% effective to stop you from getting severe illness, and this has been seen as a vaccine that is really quite effective. So in terms of that, the COVID vaccines are extremely effective, and that is what we're seeing. We're really seeing waves that are just being crushed by vaccinating enough members of the population to reach a level of herd immunity. Some questions we have also been asked about the vaccines is that I see Nellis is also answering some questions on the side as I'm talking. So I'm just going to keep talking, and Nellis, feel free to keep answering. That's fine. We see people ask us about side effects and about contraindications. So side effects are firstly things that you experience after having the vaccine. So you are expected to experience the effect of your immune system waking up to this vaccine, so that your body can get ready to fight a virus when that virus does come to the fore. So those symptoms of your immune system waking up are things like pain at the injection site, could feel like quite a bit of a bruise, lymph node swelling, some sweating or fever, body pain and muscle aches, headache, your throat feeling a bit sore, a bit of sinusitis, runny nose, sort of symptoms that you would think of as fluish kind of symptoms. All of these symptoms should pass away within a day or two. If they don't, and if you feel really bad, it's worth going to your doctor so that they can check you out and see what's going on. Some of the things that we have found is, because we've been vaccinating a lot of people during the peak of our wave, and people come together and people move around, we do find that some people do actually get infected with COVID, and then they think the COVID infection was caused by the vaccine. Now, it's important to remember a vaccine does not contain a virus. So you could have gotten that infection before coming to the vaccine site, potentially during the vaccine site, potentially after the vaccine site as you went about your normal business. But it wasn't the vaccine itself. The vaccine can't give you COVID. But if you are really sick, it's important to potentially look and get a test for COVID, because you could have COVID if you have symptoms of COVID. And this is one of the confounding things that make people feel, yes, but I wasn't protected by the vaccine. We must remember your immune system waking up takes some time. Somebody is protected against the virus 2 to 3 weeks after having received the vaccine. That's when your immunity has really woken up. And with Pfizer, people are protected a week after having had your second jab of Pfizer. Okay, another little bitty about Pfizer, you get 2 jabs, you get them 42 days apart. That can be up to 6 months apart, but we really don't want to give it to you earlier than 42 days because we want you to get the full effect of the Pfizer vaccine. And we've seen that anybody that gets the second jab too close to the first jab really doesn't have that full effect of vaccination coming to the fore. In terms of contraindications to the vaccine, we really have not found contraindications. If you have a chronic disease, be this hypertension, diabetes, asthma, epilepsy, COPD, if you have cancer, if you have any other disease that you have been, autoimmune diseases, renal disease that you have been diagnosed with, none of these are contraindications. What we do want to make sure is we don't want you to be actively ill when you come for the vaccine. So don't come to the vaccine site if you have flu-like symptoms of COVID, and don't have your vaccine while you are actively ill in the hospital. So when you then, another thing is breastfeeding and pregnancy. Pregnancy is not a contraindication. Previously, there was a recommendation that you should be at least 14 weeks pregnant before getting the vaccine, but this has since changed. They don't want people going for pregnancy tests to check whether they are pregnant because it's not necessary. You can have the jab. And if you had the jab and you later found out you were pregnant, it does not matter. Your pregnancy is not affected by the vaccine. Same with breastfeeding. You are not going to shed anything in your breast milk, and you are safe to keep on breastfeeding after having had the vaccine and even while you are having the vaccine. Okay. I think those were some of the important things that we had. I would just like to go through the questions. We were given 14 questions or 17 questions. And I'd just like to check that we have answered all of them. But then I also want to check, Nalis, I see you've been typing a lot. Any specific thing you would like to address?
Yeah, I maybe just want to add, I think it's probably in the news a little bit more. I think people that have had COVID have suffered with side effects a long time after they've had COVID. And I think it's worth mentioning, apart from, dying and ending up in ICU, a lot of patients have a long-term, what we call morbidity. So in the media, it's called long COVID syndrome. And this can last for months, 6 months to a year. Unfortunately, we've only got data for about 18 months. But there was a question, can the lung tissue repair itself? Now, people that have had severe COVID pneumonia, again, I must just mention, I'm not an expert with following up these patients. I get them through ICU, and I do not follow them up personally, but one of my family members is a pulmonologist, so he follows them up. And people that have severe COVID, there are a small proportion of them that end up getting interstitial lung fibrosis, which is a chronic condition that is irreversible. And some people, depending on how long they were sick for and what the comorbidities were and how old they were, get permanent damage. If you ended up having a pulmonary embolism, so that's a blood clot in your lungs, which is a complication of COVID, you are left with probably permanent shortness of breath. So people that have had the vaccine get a very mild COVID. So it's very unusual for you to be that sick after you've had the vaccine. So I think it's something we don't always keep in mind, is that the after effects of the vaccine, of having COVID, last for months and is quite debilitating. Some people have cognitive impairment, problems concentrating. The shortness of breath persists for months after that. So it's not just a simple flu. There was another question that asked, has anyone got COVID twice and was vaccinated? Not to my knowledge. The vaccines have only been around for so many months. I can maybe just mention, I think people do have this misconception that if I've had it once, I won't get sick a second time. In the Western Cape, there's been, as far as I know, about 6,500 reinfections. So these are people that have had COVID and got it again. The vast majority of them had mild illness, but we've had specifically one patient that had COVID, got sick, got better, and about 4 months later got COVID and unfortunately died. So there are rare instances where actually you can still get severe COVID even though you've had COVID beforehand.
I'd like to thank you so much, Nalis. I'd like to respond to a question in the chat, which is about booster vaccines. We are getting reports that the Johnson & Johnson cohort will probably be offered a booster vaccine. The question relates to Pfizer. There has been no reports that we are going to get boosters for the Pfizer vaccine yet. What are the impact of boosters is the question. Now, I think this relates to the whole question of immunity and what type of immunity you build up into your body. A lot of people are concerned that the vaccine-induced immunity that their body builds up is in some way inferior to a natural immunity that your body builds up. Now, there have been a few helpful studies on this, and specifically one that came out of Israel. We know that Israel has had a very good vaccine drive, and most of the people in the country are vaccinated. They followed up people's immunity to a second infection to check who would be more susceptible. So people who had COVID naturally and then were treated and recovered, their immunity to a next COVID was quite good. It did wane over time and became less. People who got vaccinated as a first, their immunity was actually slightly less than the people who got COVID naturally. But what we must remember is that the people who got COVID naturally also had to then survive their COVID in order to have had the natural immunity. So there's a bit of a confounder there, which makes that the vaccine-induced immunity is safer than the natural immunity. But what they did show is that whether you have had COVID or had a vaccine and then get COVID, so as a breakthrough infection, your immunity builds, which means that then after that, your chance of getting COVID again or getting it worse or getting it severely decreases with time. So a booster vaccine and a breakthrough infection, they both do the same thing. They make your immunity slowly but surely get stronger and stronger. And that is what inevitably in the end makes that a pandemic goes away, is that enough people in the world have gotten that immunity build up over time. With COVID, what we're seeing though, is that if you are not vaccinated and you get this COVID naturally, as Nala says, the chances are you could die. And if we are going to risk that, then we get to the point where the healthcare system gets overwhelmed and people die and it becomes difficult. So at the moment, we are not sure how long the vaccines last. We have seen people that have participated in vaccine trials from September of 2020, and they have had their immunity is still lasting, but it looks like it is inevitable. Some booster shots will come online at some point, in the same way that it is with the flu vaccines as well.
I can maybe just add, I think it's Pete, that's a very good question. I think the difficulty is measuring what your immunity is like, and the only thing we have is to measure the amount of antibodies what you have, but you've got different cells which we call memory cells, and they carry the memory of the virus. So we do not know, even though you might have very few antibodies left, we don't know what will happen when you get infected, say 2 years from now. Those memory cells might be very quick to respond and make antibodies, but it's difficult to know at this stage if that will be protecting you from hospitalization, death, or ICU. I think the one thing that is not in doubt, and I think must maybe just say this on the side, is that there are obviously in the medical community, there are people that are skeptical about things, and we have to say that I think within every organization there are people on both sides, and I think we must make peace with that. But I think what is not in doubt at this stage is that a vaccine protects you from hospitalization and death and severe disease. And as Zilla says, I think this is the important thing. Your natural immunity, if you take that chance with your natural immunity, there's a chance of death. And I think if people are willing to take that, that is their own choice. And I think the sad bit, I think, so this whole pandemic has been the lives that we've lost of young people. Not that elderly people, doesn't matter, but you know, a working father or mother has got a lot of consequences for our family structures and so forth. But yeah, I hope that gives you a better idea. But I think unfortunately the virus is only 18 months old, so it's very difficult to tell anyone what will happen 3 years down the line, 4 years down the line, 5 years down the line. We will need to learn to live with COVID, whether we like it or not. I think the reality is at some stage everyone will be exposed to the actual real virus, and what we just try to do is just prevent as many deaths as possible, and that is the whole aim of us in the hospital. And it is actually true, prevention is better than the cure.
Absolutely. There was another question about variants. We have seen that the vaccines that have been created, the current Moderna and Pfizer, as well as Johnson & Johnson, we know they were created during 2020. The vaccines themselves, they started off in a very specific shape based on the first variant of coronavirus, of this COVID-19. And we've since had a couple of variants, Beta variant, Delta, and now we've got Mu coming up. And it does look like the vaccines are doing well against the variants. People were very worried that with Delta, it would show that the vaccines are not as protective. But it looks like the protection has stayed and has remained adequate across the variants. What could happen is that the booster shots will have a update so that the variants will also be addressed in those new booster shots, as is with the flu vaccine. As is with the childhood vaccines against mumps, measles, rubella, and those other things. Over the course of years, these shots are always updated to include new variants. But the base vaccine is still protective against the new variants. So many people ask, shouldn't I just wait until there's another variant and then once the vaccine is updated, then have my vaccine? So to that, I would say no, because you always risk getting the vaccine completely with your body having no protection at all, and you don't know what the effect of that is going to be on your body. You could be one of those unfortunate people who does die, even though you are young and don't have comorbidities. So in terms of variants, it looks like variants are being addressed by the vaccines, and it looks like they are protective against multiple variants. Okay.
I think there was one question that I maybe just want to respond to, and there was a question about outbreak under in vaccinated people. And I think the saving grace of the vaccine is that it prevents hospitalization, serious illness, and death, because we can easily be overwhelmed. And I think that was I think one important factor why our deaths relatively was very much contained in the Southern Cape and the Western Cape, for that matter, because we weren't overwhelmed. You know, once we get overwhelmed, then the mortality rate just goes up because we can't care for people. So I think one thing is that the vaccine is not, and there's data that has come out, the vaccine is not going to stop the virus at this stage. The virus can still be spread by people even though you've had the vaccine. And I think that's important to remember. It does not mean that you can't get COVID. It does not mean that you can't spread the virus. So that is why there are still factors in place, even in some countries that are very well vaccinated, that there are still a bit of social distancing, mask wearing, and so forth. So I think, unfortunately, although we feel, my goodness, when can we return back to normal? Unfortunately, this is the new normal. And whether we will get rid of masks and things like that probably will, this is my opinion, is probably will happen in about 2 years or so, or when everyone has been exposed to the virus. But yeah, that is just an opinion.
Thank you, Nellis. I see one last question, and then I'm going to allow us to close off. Can I get an understanding of the mutation of variants? Is it caused by vaccinated or unvaccinated people, or both individuals can spread these variants? So I think the first thing to remember is variants are caused by viruses and not by vaccinated or unvaccinated people. We must try to make sure that we don't create divisions against people who are vaccinated or not vaccinated, but rather that we work towards what is the best solution going forward to keep as many people alive and well and healthy as possible. The virus multiplies, and as it multiplies, it makes different variants. We can think of this in terms of humans. When I have children, then no two look alike. And what happens is when the virus is multiplying immensely, like as we currently have with a pandemic across the entire world, it means that the opportunity for variants is just so much higher. If the virus was only a very low load in the population because it was being contained very, very well, then there would be much less variants. And even if there were variants, they probably wouldn't survive. At the moment, there's so much virus going around in the world that the opportunity that one or two variants do then successfully replicate and continue to infect people in a different way is just rife. So the more people who have an immunity against the vaccine, the lower the viral load in the community will become, which means that the less variants will end up coming into the system and replicating and moving on. Okay. Great. I think that's that for us. Gerard, maybe you would like to close off?
Thank you, Zala, and thank you, Nellis. Before I close off, I think it's important to also allow Herman, who's our communications lead at the District COVID Command Center, to just give us a way forward, because I think there was a lot of questions asked today that we will note on our questions and answers part of our website. But there's also maybe a need for future sessions like this. So I will hand over to Herman and then I will close off. Thank you.
Thank you.
So good afternoon, everyone. Can you hear me?
We can hear you, Herman. You can go ahead.
Okay, so my name is Herman Pieters. So what I'm going to do today is just to share a few things about the news media and also trusted sources of information. Our municipality's website is, as a district municipality who's leading the COVID-19 response in our region, is one of the trusted websites where the public can find information about COVID-19 updates. We issue statements each day from the Disaster Management Center and upload it to our website. You will be able to see on our website at the top bar that there's a COVID-19 button on the menu. So under there, we've got some questions and answers, and also the statements issued by Mr. Otto during the course of the day. The other things I need to also touch on is the other websites, mostly South African, that's important to take note of. So the first one would be the National Institute of Communicable Diseases, the NICD website. So that's www.nicd.ac.za. And the Western Cape Government website, where they've got a provincial COVID-19 dashboard. That's managed by a data scientist from the Western Cape Government Health, and it's updated daily at 1 o'clock. That website is coronavirus.westerncape.gov.za. The National Department of Health website, the South African Health Products Regulatory Authority, that's SAHPRA, the World Health Organization. And then there's a number of other websites linked to governments across the world that can be visited. And I think some of those would be the FDA and the CDC in the USA. So those are the main sources where the media gets information. So where I want to go next is to caution the public about using profiles of random people on social media as sources of news information. Many of the links posted to these social media pages are often shared to provoke a reaction from communities to specific opinions. The media can also be used to promote political ideologies and opinions. These usually fall on the edges of the media spectrum, either on the extreme left or the extreme right. So I've made a few notes on who are center aligned. So that means journalists that report ethically about the COVID-19 vaccines and COVID-19 situation across the world generally. So this is not limited to this list. It's just a quick list that I did my research on, and I've seen a lot of articles published by them. Those are the ones that we share. The others I'll also touch on, but it would be, for instance, in South Africa, it would be ENCA, the Sunday Times, the Mail and Guardian, the SABC News, and then internationally, it would be something like the BBC, Bloomberg, the Wall Street Journal online. You've probably seen the NPR online and the Inside Story. And then on the ones you should be cautious about is the partisan right-wing and the partisan left-wing media. So left-wing would be extremely liberal and right-wing would be extremely conservative. So if we look at the extremely conservative websites on the right-wing, it would be Sky News Opinion. So that would be personal opinions of news reporters, Fox News Opinion, the New York Post, Daily Wire, InfoWars, and Newsmax. I'm sure you've seen some of the controversial information published by them. And then on the left wing, the Mirror, the Guardian, CNN Opinion, MSNBC, the New York Times, those all fall more on the extreme left wing of the media spectrum. People contact us to find out if information is true. So we always check the links first, and then we assess it according to where it falls on the political spectrum. And then we would know to share it or not to share it. And we verify it then with our counterparts at other spheres of government. Thank you.
Thank you, Herman. Yeah, thank you for bringing that to our attention. I think it's important for us to know where we can read the truth and what is fake news or not, because I think we're living in a time when there's information overload and we need to make sure that we get the truth out there. Colleagues, what I've also seen is there's questions in terms of sessions at high schools. I will have a discussion about this in our next meeting tomorrow, and see how we can do this to maybe also include high schools in our sessions going forward. I'm sure that those that was online today found it very valuable, and they will tell their friends, and their friends will tell others again. So I will ask Herman and the team that's working with this, thank you very much for putting this together, to try and mimic this and do similar sessions going forward, as I think all of us would like to have a normal Christmas. And Nellis, I think you don't want your ICU full again in December. So colleagues, I want to say thank you very much to everyone that was online, everyone that did the trouble to tune in for the last hour. If there's questions, think about them, write them down. So when we've got a session like this again, then you've got them with you. When you hear something that you're not fully aware of, and you don't know how to place it and where to put it, and it's still making you uncomfortable, make a note of it, and then we can discuss that at our next session, a similar one to this. So I want to thank everyone again, and a special word of thanks to you, Nellis, and the team at the George Hospital for the hard work you do. Thank you for keeping the garden routers safe. I just want to end off by telling you at this point in time, 40% of all garden routers has been registered, 29.5% has been vaccinated, and of those, 23.8% is fully vaccinated. So we've got a long way to go to get to the 70-75% before the end of November. But sessions like this and all of us working together, I'm sure we can get there. Thank you very much. Appreciate it. This is then adjourned. Thank you.